are going to be about much more than just the health accord, so I think Canadians should be happy to know that we have a long list of agenda items all related to making sure that Canadians get the health and the health care that they need. We're very much in a spirit of rolling up our sleeves and getting the work done. In terms of the health accord money, there's still work to be done in terms of hearing where new investments would go. I think that they've heard the message from us that we are absolutely interested in being a good federal partner in making sure. Are you happy to be done on this?
Ready to go. We've got a good working relationship in Ontario. We need to extend that across the country because, as we well know, there's so much diversity in terms of Indigenous health issues. We've got our challenges within the process, but we've got commitment from both the federal and provincial government here in Ontario. But we need to ensure that we configure ourselves as partners and that this is about health equity. And in Ontario, we've made some good gains. We need to see that consistently spread across the rest of the country.
As a federal health minister and as provincial and territorial health ministers, we each have a role to play in that. And in fact, there are a tremendous number of steps that we can take to increase the affordability of medications. And I think we were all quite pleased with that discussion. We had a great presentation this morning from Anne McClellan, who is the chair of the task force on the introduction of the legalization and regulation of cannabis. The ministers all are looking at the implications in their own jurisdictions, and again, there was a good presentation and some very interesting questions that were raised. This afternoon we discussed other issues, including some public health issues. One of them was the opioid crisis that we're facing across the country. We expressed serious concern about this issue, for which many Canadians have lost their lives, even in recent days and weeks. And we talked about the steps, again, that can be taken by all health ministers across the country to make sure that lives are saved, that we prevent further challenges in terms of the number of overdoses and deaths associated with opioids in the country. We also had a good discussion today about Health Accord and about furthering the discussion that we began when we met together in January around a number of shared priorities. It is our desire as health ministers to make sure Canadians will have health systems that work for them where they live in this country. We talked about the fact that this is a time where increasingly we agree that home care is something that we need to do better at, that every province and every territory are working in very creative ways to be able to make sure that people living in their jurisdictions have better access to home care. And so we talked about the fact that that's something the federal government's very interested in investing in, and we'll have further conversations about those mechanisms. We discussed mental health and my firm commitment to find ways that we can increase access to mental health for Canadians. And this is something that resonated well and that all health ministers recognize is a challenge and something that we'd like to invest further time and energy into helping Canadians with. A third area was around innovation, and innovation, we said, spreads across every area of the healthcare sector, and in fact there's a tremendous amount of opportunity to innovate in health systems, but also to innovate in new technologies for health. And again, I want to say that the provinces and territories have done a fantastic job in being able to provide innovation. The bottom line of our meetings essentially is a real desire to put patients first, and I think despite the fact that there's been discussions about some of our conversations that are at times challenging. It is the desire of every one of the 14 of us here to make sure that Canadians have the health that they need, the health care that they need, and that we put patients first. And it's important to do that, to make sure that those issues are discussed and the new mechanisms that we can use to improve the healthcare system. Ultimately, of course, there are discussions around the dollars attached, and we'll continue to have those discussions. But I've been pleased about the fact that there is so much common ground amongst us. There is so much desire to improve the systems for Canadians, and we are going to find the ways to be able to invest together in the health systems that Canadians need. Thank you very much.
Well, thank you, Jane. And
have to discuss at first. We have to have the means to address those issues. And as of today, we are facing a cut of $60 billion. So today we agree on everything in terms of area of interest. but we have a message as of today, might not be the same at the end of the process, that we will have less money to do more, because the area that we have identified and agreed on, it's additional services. Now, where that leads us is that about 3 weeks ago, the Council of Federation sent a letter to Mr. Trudeau, who answered to that letter that first we had to have that meeting, this meeting. And this meeting is leading us where I said moments ago. So the next step, which might be the right step, I hope it will be the right step. The next step is a meeting between the premiers and the Prime Minister somewhere in December, as I understand it, where I hope this item will be on the agenda, and after which I hope we will have better news. Because I would say that the future at this point is a bit dire. So this is my opinion as of today, but I am in essence very optimistic. I think there are always a solution to all problems. I think the solution to me, in my eyes, is quite obvious, but this is still to be discussed, and obviously it will be discussed at another level.
New money for healthcare needs to go to healthcare, which implied that in the past it hasn't gone to healthcare, and certainly some of your colleagues standing with you took that implication. So what evidence do you have that it wasn't going to healthcare?
So thank you for giving me the opportunity to clarify. I want to make I apologize if people misunderstood. There was no sense of saying that the amount of money is not, that equal amounts of money and then some are being used by the provinces to deliver care. Of course, $36 billion is being handed over to the provinces this year for healthcare. That actually goes to general revenues. It's drawn down along with other priorities that provinces and territories have to be able to be spent. So I'm not making there's certainly no intention to make accusations. There's certainly an understanding that provinces spend significant amounts beyond the Canada Health Transfer for health. What we're talking about is new investments in healthcare, and that's just what I talked about, the fact that when we're investing in home care, I think people in this day and age, health experts across the country believe in measurement, believe in saying, how is home care going to be better? That $3 billion that's been estimated could provide, I think, 50 million days of home care, for instance, if they wanted to spend it that way. So we want to be able to see where that money is going to go. If we're putting new money into mental health care, it would be great to be able to say this many hours of therapy were delivered with this amount of money. So the idea is just to have a sense for Canadians to be good stewards of taxpayers' money, to make sure that money's spent well.
Yes, can I just want to add to that, if I may. So that implication certainly was received. I think that many of us, provincial and territorial health ministers, took issue with that comment, suggesting, or certainly implying, that perhaps funding provided by the federal government, which we need to remember is approximately 20%, 80% roughly of the funding provided to health services across this country come from provinces and territories. But to suggest anything other than that every single dollar of that transfer goes to health services in the provinces and territories. And you've probably had a number of us march up to the microphone and actually assert that. And certainly in Ontario's case, when you look at a 6% escalator, that translates into a 1.5% increase of our global health budget in Ontario. And we have never had a year. In fact, we've had many, many years where our year-over-year growth has been 5 or 6 or even 7%.
Health transfer and the impact of the changes. The impact isn't the same across the country. In 2014, with an arbitrary decision to go to a per capita funding, British Columbia lost $200 million annually. So even though we are getting 6% increases, 5% decrease because of the per capita funding. So we're really getting 1% increase in the Canada Health Transfer. Meanwhile, we've been trying very, very diligently to bend down the cost curve to about 2.83% per year. But only 1% of that was coming from the federal government with the changes in the Canada Health Transfer. And as Minister Hoskins said, study after study shows that while you might be able to do that in the short term, and Quebec has done the same, you can't do it over the long term. And especially not when you're transforming a system, making new investments. The unmet needs for mental health and substance use are clear to everyone. So I think this is something that our first ministers and finance ministers will continue to discuss. I can tell you we have a very respectful, collaborative relationship with Minister Philpott. She has been a champion for evidence-based decision-making and helping us in British Columbia save hundreds and hundreds of lives, and I want to thank her for that. So I want to have the evidence put forward that shows that we need an increased level of federal participation in order to make healthcare sustainable for all Canadians.
So proudly of Canada's healthcare system. I think that that's something that we want to reinforce, that we are all very proud of the system that we have. And there are certain pillars that back that up, including universality. I absolutely understand and I'm open to discussions around details around how additional money will be allocated outside of the Canadian health transfer as well. So I think it's fair. It's Canada's healthcare system that we are advocating for and working for every day in our own jurisdictions. And I think it's fair for us to talk about some of the conditions that Alberta's government will certainly achieve in response to increased allocations. But rest assured, there is need in all parts of our country for increased allocations. This is not a question about whether there is need or not. If it's a question about increased criteria, because certainly in Alberta, our government was elected on a platform that is very well aligned to the federal government's platform. Canadians have spoken over and over again about how they want to see a strong public health care system for decades to come, and we have a responsibility to deliver on that.
Particularly for, obviously we're focused on the health accord here and the Canada Health Transfer, but the progress that we are making on other important files, including the opioid crisis that this country is facing, including on access to medications that we spoke about today, and there's tremendous opportunity being realized in terms of collaboration. So similarly, as we are seeing that collaboration and partnership bear fruit for the benefit of Canadians, we're asking for that same level of partnership through the health accord, through the Canada Health Transfer, so that we can do the work that we're tasked with doing and meet that responsibility that we have to Canadians to build the best healthcare system this country can possibly have.